You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, Dr. Beckham. Dr. Beckham, welcome to the program.
Thank you for having me.
All right, now before we get into today's topic, tell me a little bit about your practice. Who's your typical patient? What are the different services you offer?
Okay. Well, really, I don't have a typical patient. We're a family practice. I see children from the age of 3, and then I see adults, the whole entire family.
Lots of families coming in?
Lots of families, yes. So we see, moms, grandmas, grandpas, little children. So a gamut, a mixture of all the people.
So you do a lot of things under one roof there?
Yes, we do sedation dentistry. We have patients that are very busy, so we can get a couple of things done in one visit. We also have patients who are, really scared. They don't want to be in the dental office. So we do a lot of sedation where they're nice and comfortable. So that's good.
People don't like going to the dentist, right?
That is correct.
I mean, they tell you that?
They actually, come in and say, oh, I don't like going to the dentist. I hate the dental office. This place is scary. So we try to make it as pleasant and non-scary as possible. So sedation dentistry really helps us do that. And we try to be as friendly and as nice and supportive as possible.
They come in grumpy, you said. And you turn them around.
Oh, we try to turn them around, yes. We have patients, that'll come in and they'll say, I'm just grumpy. Well, actually, they don't say they're grumpy. They come in, for example, a guy will come in just all mean-faced and grumpy, and then just throughout each visit that they come in, you see they're loosening up a little bit more, throwing a little jokes, things like that. So we make it nice and pleasant, and I feel like...
Do they finally admit it? Hey, okay, I gotta admit I like coming here.
Well, they'll say, when I first came in, I didn't like it, but, now I like how you operate and things like that, so.
I guess you have your own lab or machine. You make crowns right there.
Yes, we have a CRX.
Is that real?
That is, yes, it's real.
Day?
Same day, within a couple hours, actually. So a patient, it's called a CRX machine. Patients will come in, they'll need a crown. We get the crown prepped, and usually the old technique was we'll go out, spend 2 to 3 weeks out in a lab, and they have to wear a temporary that it's uncomfortable. You have to watch how you're brushing and eating.
Is that how it happens right now at most offices?
At most offices,
okay.
Yeah. They go out, and the patient has to come back in for that second visit. Well, with the CRX machine, they come in for one visit. And just while they're waiting, they actually have their crown made, and it's a porcelain crown, very strong, very sturdy, and they have it made in the office so they can go on about their lives. They don't have to come back in for that second visit.
You say you're into gadgets in the office.
I love technology. I love my gadgets.
So you have all the new stuff?
Yes, I have the new, we have laser dentistry that we use for our patients that have bleeding gums and gum disease. We also have a special kinetic cavity prep machine, which is we call for short KCP, and basically what that is a sandblaster, and it'll sandblast cavities out without any anesthetic, so I don't have to give that shot for some surface cavities.
Nice.
So I think that's a great asset for my patients. We also have a special camera that detects decay. So we can use our camera so we can actually show the patient a picture of what their cavity looks like. So
like on a screen in front of them?
On a big screen in front of them, so they can actually see what I'm seeing in their mouth in real time. We also have intraoral cameras that most people, when you talk about what their teeth and what is going on in their mouth, they have no concept of what that means. It's like, oh, you have a cavity here, this filling's broken down. It's just my word, but if I can actually show them a picture, they can see, oh, that's kind of ugly. That's kind of nasty. I don't want that in my mouth.
I have seen those photos where it looks like a huge crack.
Yes.
Because you never know. Could I live with this crack for a little bit longer?
Exactly.
This happened to me, by the way. I said, no, I'll just wait. I'm fine. And then he showed me the crack. I was like, you got to be kidding me.
Yeah, because you see it. It's a huge crack. So it's okay. I can baby it a little while. Well, no, you can't, because that babying and that small crack actually will turn into a big crack, and next thing you know, you have to lose a tooth, and then we'll have to do some implants.
All right.
So yeah, the camera is great to actually show patients what I'm seeing in their mouth, so they can actually see the importance. We also have adult orthodontics, 6-month smile system. It's a way to do orthodontics in a shorter period of time, a relatively short period of time.
They're clear or metal?
They're actually clear. They're tooth colored, so it kind of blends in with your tooth. So that way you don't see it. So that stigma of having that metal braces, that doesn't happen with the 6-month smile system. And the newest trend in dentistry is dental implants. We can actually replace a single tooth, or we can replace the whole entire mouth.
Okay.
With implants.
So at the top of the show,
Yes.
And people, for people that are just tuning in, we're, according to Dr. Beckham, no more dentures.
Yes.
And so that's true.
That's true, yes, no more dentures. I mean, there is no reason why you have to have the typical traditional denture that kind of rides around in your mouth. I mean, we can do dentures that can snap in and actually feel like regular teeth.
So are there a lot of people in where you are that wear dentures?
Yeah, yes, there's thousands, tens of thousands, probably millions of people who wear dentures.
In Kentucky?
Yeah, in the state of Kentucky. So, and these dental implants, they could help change their lives.
So let me get this straight. So like 2 implants or 4 implants, just a snapped in, locked in, a full arch of teeth.
Exactly, a snap in that doesn't ride around on their gums, that doesn't cause sore spots, because these dentures will lock in and be stable with these dental implants.
Now, if it's so good, right, why aren't they all doing it? If there's so many denture wearers, and why aren't they doing this?
Well, one, most patients that have dentures had bad experiences. You know, they had to have all their teeth out. They had to go to the dentist a lot. The dental office is not their favorite place to be.
Okay.
So,
yes.
you know, so now they don't have teeth. They have dentures, so they don't know what there is to know about dental implants. There's nobody talking to them about it.
Because they don't go to the dentist.
Because they don't go to the dentist.
All
I
right.
mean, yeah. So why would you go to the dentist?
That seems very painful, though.
That's the misconception, I think, with dental implants. Your bones don't have a lot of feeling in them. So once we put the dental implants in, it's just like a root of a tooth. So you're not going to actually feel it. It's more, I think it's less painful than a root canal.
What do the patients say? Are they ever surprised, like this didn't hurt that much? Or?
Well, my mom was one of the first patients that I did an implant on, and her concern was, oh, it's going to be painful. You know, I'm gonna hate this. She was missing a lower tooth down here. She didn't want to do a bridge. She didn't want to mess with those other teeth right next to the space that she had. But she was always complaining that, oh, I'm sticking my tongue in there and keep sticking my tongue in there. So I'm like, okay, we'll do an implant for you. She was really worried about, oh, this is going to be painful. I don't deal with pain very well, you know. And of course, it's my mom. I don't want to hurt her, but I placed the implant in. I gave her Advil for any discomfort that she might have had. I'm not even sure she took the Advil, because her one complaint was, it's cold. You know, I'm outside. It was in the winter when I placed it in.
So you called her? I
called her to make sure she was okay. You know, I got to take care of my mom, and so she was saying, you know, we're outside and it's cold and I feel the cold in my mouth. I feel it. I'm like, well, Mom, quit talking so much while you're outside. It'll be fine. She had no other complaints and my mom, who will complain to me about anything, didn't really complain about any of the implant procedure at all. She said it was comfortable. Like I said, I don't think she even took the pain medication that I gave her, which was the Advil.
Now, for the people trying to avoid false teeth, right?
Yes.
Their mouth is a mess. You said that you almost seem to attract people that have really bad situations going on. Like haven't been to the dentist in 15 years. Well, and you say they feel real guilty or something.
Well, they feel guilty that they let themselves go. Okay. You know, a lot of the patients that we see are people that want to do for their families first before they do for themselves. So I'll get the mom that comes in. It's been 15 years since she's been to the dentist, and she comes in just kind of covering her mouth, saying, you don't want to look at my mouth because it's the worst you've ever seen. And it's okay for them to be scared and apprehensive, but it's not okay for their teeth not to be healthy and not to have the best smile that they can possibly.
But you say
have.
They don't judge them.
I don't judge. I take it as an opportunity to improve their lives. So.
But if they have bad gums, so people, their mouths are a disaster, don't they have gum problems? So how are they able to get dental implants? Will they stay in the mouth?
Well, once they get their teeth removed, because that bacteria is going to ride on those teeth. The bacteria is going to attach there. So once those teeth are out and removed, their gums are healthy. They're, it's very healthy, a healthy mouth at that point. So yes, they're a great candidate for dental implants.
What are the age ranges? How old can you be to do this? So talking to the people with false teeth or denture wearers or headed toward dentures, maybe like their parents or whatever, what's the age? Is there an age limit?
No, there's not an age limit. I mean, anybody who has missing teeth can have a dental implant. I mean, I have colleagues that have done implants on 100-year-olds.
Really?
Yes.
Why would they want to do that?
Because they need to eat. They need to chew. So, we have a patient who's maybe in a nursing home that is using this denture but can only eat soft foods, and that's kind of messing up their digestive system. So once they get those dental implants, they can actually eat meat and steak and eat some of the healthier foods that was good for them to, continue their life.
I asked you in the green room because you no longer really like dentures, but you've
No.
made a lot of dentures, you said. Like I said, over 500? You said yes, over 500.
I've made a lot of dentures in my dental career. And, I don't like doing a typical denture anymore. I mean, I realize some people need to have those teeth removed because of their condition of their mouth. However, I don't want to just do the plain dental or the plain denture. I want to be able to give them teeth so they'll be healthy and be able to chew and be able to have a longer, healthier, happier lifestyle.
So locked on to some...
Locked in, snapped in dentures that, for most patients don't have to take out. They don't have to wake up in the morning and put their teeth back in from the cup that's sitting by their bedside. They can actually have those teeth go to sleep and be able to be comfortable whenever they're talking or laughing or just being out, and they don't have to be self-conscious and keep their hand over their mouth so their teeth don't slip and slide out.
Are denture wearers, I know a few denture wearers. They never complain to me. Are you saying there's really not a happy denture wearer?
Of course they're not going to tell you,
Okay.
their discomfort. They'll come in and they'll tell me, oh, I hate my denture. The only reason I actually put my denture back in is just to go out, but I can't eat with my denture because it's moving around and riding around. So that's the perfect patient for a dental implant because they'll snap it in, they can chew out in public, they can laugh out in public out loud. So those are the patients that I want to see. I mean, I wish there was a try-in period for dental implants. Like I put implants in that day and let them try it out over the weekend and then bring it back if they don't like it. I doubt anybody would bring them back in and say, oh, I don't like it, because it's going to be that much different. Once they try those dentures in and try it with those implants and they're stabilized, there's no way you want to go back to that denture that's riding around and slipping around in your mouth. There's no way.
Now, your training after dental school, you've
Yes.
had a lot of training with dental implants?
I have. I trained under one of the best, Tony Feck. He's in Lexington, Kentucky. Learned about the implant system and how easy it is for me to give my patients what they need to be able to smile better.
So you said you made 500 dentures.
Yes.
Or plus.
Plus.
And some of those people are going to watch this show. They're going to see you and say, oh, there she is. She looks even younger than I remember her, right? But what do you say to them as far as why maybe they should come in for a visit to find out more about their options?
Some of those denture wearers that I've placed dentures in, the past years, I haven't seen them back.
For 13 years, right?
Yes.
Okay.
I haven't seen them back, and I would love to be able to help them out in their situation, because a lot of times they don't know, because you don't know what you don't know, and if they find out about implants and how it could help stabilize that denture, help them just be able to keep the bone that's in their mouth so their mouth doesn't seem shrunken in, that's the people I would love to reach and be able to help them just to be able to smile again. I have a patient who came in, one of my first full mouth dental implant patients, and one of his complaints was, Doc, you got to do something about this denture. He didn't come in because of implants. He came in because he was complaining about it. He thought he needed a new set of dentures. He's like, Doc, you got to do something about this denture. I talk and it just keeps falling out. And I was kind of examining him. He had all the perfect conditions for an implant: good bone, good gums. And the denture itself was actually a nice looking denture. He just couldn't keep it in. He said, I only take it out when I have to go out with my wife.
Okay.
I'm like, okay. He goes, yeah, because she doesn't want me going out of the house without my teeth, but I regularly wear it.
So the only time he would even wear it is when he's out with his wife.
When he's out with his wife.
Okay.
So that was his complaint. You got to do something. I need a new set. So I was just kind of talking with him. I'm like, I'm doing this new procedure, dental implants, and I think it'll be good for you. So I kind of talked to him about his options, 2 implants, 4 implants to be able to stabilize that denture. And he's giving me this look of, that's almost too good to be true. I said, yeah, let's try it out. Let's see how that works.
What did he pick, 2 or 4?
He actually picked 4 implants. And so we placed 4 implants here, so 2 here and 2 back here to stabilize this denture, because, like I said, it was kind of riding forward on him every time he talked. And what the first, so I'm starting him out on soft foods. I'm like, don't go hog wild. Just, you're going to eat some softer foods. I think he said the second night he was eating chicken like it was nothing. He was, oh, that's amazing. So I had to bring him in just to kind of make sure he's doing okay. It's like, I'm eating chicken again. This is great. I don't have to worry about, my wife going, your dentures are slipping, and embarrassing her out in public. So, he made me feel so grateful that I could do this for him, because he's all smiling now. He was all happy when he was leaving. He's greeting everybody, and you can just see just how much those dental implants have changed him in his life.
So pain, though, it seems painful, and I asked you before, what did he say?
Actually, I don't think the pain actually came up because it wasn't an issue. We placed those implants in with very minimal bleeding on his part. So it's not like the old style implants where you have to cut the gums, there's bleeding, you're in a hospital setting and things like that. It's so streamlined now, and the technology that has improved the dental implants is so much better because we can place them in, minimal bleeding, minimal pain, and you come out with a great result.
So they're just locked in. Now, how often does he have to come in and get them cleaned, or what's the home care?
Home care is brushing your teeth. So he can actually snap that denture out, brush his denture, but most of the time he doesn't even have to. He brushes his teeth like normal, and rinses his mouth out with some mouthwash so it can have nice clean breath.
So is that common? I mean, you see, because I think you told me in the green room that you are transforming people's lives
yes.
in a day.
In a day, we have a patient that I will never forget her. She inspired me. I just love this patient. She came in, and she was a little sweet lady. But one thing I noticed about her is that she came in, she was hunched over, really kind of shy, not really meeting me eye to eye. And her complaint was, her teeth were hurting. She had crumbling teeth, and she just wanted to go to her high school reunion. So that was her big motivating factor. But she was scared. She was so scared. And her husband's like, you need to go get the step so you can have a good high school reunion. So we take photos of all our patients, just so we can have the record of them so we know who they are. Her big complaint, she's like, I don't want to take a picture. Oh, why not? I don't like having my picture taken. So she really say exactly why she didn't want her picture taken. So can we at least please? And she's like this with her picture taken, her face is down, and I kind of looked up at the camera, no smile whatsoever. So through a series of appointments, we did everything under sedation. I think it was 2 appointments altogether. And we gave her a full set reconstruction smile. So she had crowns, I think 2 implants. And on her follow-up visit after everything was said and done, we're just checking to make sure everything looks good. She came in, she's like, all right, doc, take my picture. Wait, what do you mean? We already took your picture. No, I don't like that picture. Take my picture. And we took it. She's smiling. She's all bright. She had lipstick on. She had makeup on. It was great. But the one thing that I noticed about her is that she smiled not only with her teeth, but also her eyes that she wasn't doing before. So I was really, truly happy for her. And she was very, very happy. I mean, now she doesn't look grumpy. She doesn't look sad anymore. She looks happy. She looks confident. She is more approachable for other people. I mean, and there's so many people in Louisville, in Kentucky, that look grumpy and mean and unapproachable. But
they're just hiding their smile.
They're hiding their smile.
Do you see them? Do you notice it because you're a dentist? Like, I bet they're hiding their teeth.
Yes. I mean, because you'll see, some people that are just kind of and laughing without teeth, and just or kind of feel like they're mean, and you don't want to go over and talk to them. It's like the grumpy old man. You don't want to go approach them, but I think what they're hiding is that their smile. I mean, when you think about it, our expressions come through our smile. Our whole face lights up when we're happy about something, but if somebody is not happy with their smile or confident in their smile, then they're not going to be approachable. They're not going to be likable. But they're probably great people. It's just they're very self-conscious of how they look. So that's going to project. You get your smile done. That is the gateway to your soul, I think.
Okay.
And
well, you're a dentist. Of course you're going to say that.
Yes, but I mean, it's true. When you smile, everything lights up about you. I mean, that's one of the first things, and I don't know if everybody knows this, but unconsciously, that's the first thing people look at is your smile. How nice are you? How approachable are you? And if you're not smiling, then everybody thinks, oh, they're grumpy or they're sad or they're mean, and they don't want to engage with you. If you're smiling, you're happy, you have a better communication, I think, with your family and your friends. So this is something that I think is so important, even though a lot of people don't feel like I can spend that money on myself. I can't because I've got families to take care of. I don't want to, that's too big of an expense or too big of an issue to do for myself. It's one of the most important things you can do, just to even sell yourself and sell the good person that you are.
Like a job interview or anything.
A job interview.
I mean, you hire the happier person, with all things being equal, obviously.
Exactly.
Or the one that
appears to be happy. You know, that appears to be likable. You're not going to hire the grumpiest person in the room. I mean, so a job interview or just your family's outing, that's what we want to do. We want to be with our families and we want to be the happier person. But a lot of times you're so embarrassed and so self-conscious about your smile, then you're not going to portray that.
So do you think that there are people that come in just because they're in pain, right? Especially men, right? We put everything off. But do you think they come in, they just want to eat and chew and get out of pain, and then maybe the side effect or the side benefit that they didn't even anticipate is wow, they got this beautiful smile. So that happens?
That happens all the time. I mean, pain is a huge motivating factor. You either go to the dentist because you're in pain, or you go to the dentist, or you do not go to the dentist because you don't want to be in pain. So I think pain is a huge factor. So I see a lot of people that come in, they're in pain. They're not even thinking about how my smile is going to look after everything is said and done. They're thinking of get me out of pain quick. But if we can do both, get you out of pain and give you a great smile, I think that's a win-win situation.
So there's a lot of people wearing dentures that hate their dentures. They have old-looking dentures.
They have old, ugly, stained dentures. They've probably had, actually I have a lot of people that come in and say, oh yeah, I had my denture 20, 30 years. I'm shocked. I'm like, really? That long? Oh yeah, but you know, it works okay. Oh, well, to me, that's not good enough. It works okay. You need to have a bright smile. There's no reason why.
So it's affordable to do this. I mean, insurance doesn't cover it, Medicare doesn't cover it. You have payment plans for certain people?
We have payment plans in our office for anybody that needs that. But in a lot of cases, we have people who have dental insurance that will pay for the denture. Definitely. And especially if they've had their old denture for 20, 30 years. Yes, absolutely. To me, I'm like, let's give you a bright white smile, a bleach white smile. I mean, we do a lot of bleaching in our office, so why not bleach your denture so you can have a permanently white smile?
Is this the future then of dentistry? That nobody will get these regular dentures that are floating on the adhesive or whatever.
Oh, yeah.
They'll all be attached to something?
I think so.
You think so?
I absolutely think so. I think this is just a stepping stone for what's the possibility for patients who are in need of a new denture, who have never had dentures before. Their teeth are kind of, getting really bad to the point where they have to get all their teeth taken out. And for the patients that had a denture for years, I think this is a trend. Why wear something goopy and some goopy adhesive in your mouth that probably doesn't taste good? Why wear that and have the denture kind of riding around on that? Why not have something fixed and in place that is a part of you, as a part of your whole smile?
If everything works out, somebody's watching this and they have an upper lower denture, what's the fastest turnaround time where they could have something locked in? Like if everything goes great.
If everything goes great, we can have a locked in denture within a few weeks, honestly. Okay. So yeah, we can place the implants in that day. You'll have your denture sitting on top. We're going to let it heal.
And they're cosmetic looking? I mean, because I feel like I could spot beautiful. A denture.
Oh, no.
Across the room.
Oh, no. We want to make sure that when we are setting you up for the denture, we're going to pick the best teeth for you. We're going to pick the color that you want, but I like to go with a bleach white smile. I figure everybody needs a bleach white Hollywood smile. Okay. But we don't want it fake looking, we don't want those day glow teeth that I think a lot of people are like, I don't want those teeth that are white and bright that kind of glow in the dark. No, we're going to get the teeth that are best suited for you. And so we make the shapes. We have different shapes of teeth. I don't think people know about that. So we'll have a nice feminine smile for a lady. We have the masculine or more smile for a man. So we pick the denture that will be most comfortable for you.
Okay, good. You said you're a perfectionist.
Yes.
When it comes to these teeth.
Yes.
Elaborate on that. Why is that important?
Oh, I think it's important that patients have the best smile that they can give. So I personally want to make sure that you are happy with what you get, because it's not me walking around with those teeth, it's you. So I want to make sure you look good and that you have the best smile. So I'm going to make sure that I do whatever is in my realm to make you happy.
Now you say people come in with somewhat of a hard luck story. Do you ever get excited? Like in your head, you see the end result and you go, boy, this is going to be good. Does that ever happen?
I do actually have another patient that we recently, she needed to have all her teeth removed. And I said, okay, well, we can remove your teeth. We can place some implants in. And she was, nope, don't want that because that's going to be painful. And I distinctly remember going, she's going to be good. If we can get her what I know she wants, but she doesn't know she wants it yet, this is going to be good. So we removed her teeth. And I was telling her husband, she is not going to like this denture. She won't like it because it's going to move around.
How old is she?
She's actually relatively young. She's in her 40s.
Wow.
Yeah. So, and I mean, having teeth all her life, I know that this denture that's moving around and it's going to wiggle is not going to be comfortable for her. She is a beautiful lady. And so I know.
She told her husband.
I told her husband, she's not going to like it. She's going to gripe. She's going to complain. Please, please be patient with her. I said, what we need to do is place at least, and I think money was a factor for her too. I said, we can place 2 dentures, or 2 implants right here. So, 2 implants, I think that would be good for her.
To snap it in.
Just to snap it in so they're not moving around. 2 implants here, 2 implants here, I think she'll be fine. 3 weeks after we replaced those dentures, she's like, all right, doc, I can't do this anymore. They're moving around. I think it's time we need to do those implants. So I'm like, okay, we're gonna have those snapped in, and she is now in the transitional period of where we're resting before we snap those dentures down completely. So
and she's gonna love it.
She's gonna love it.
You're excited for her?
I am so excited because I can see where she's gonna be, and I know she will be way more happy. She'll be happier. I think it's a better word. She will be happier with those implants, dentures that is locked in instead of free moving around.
We're out of time. Final message, somebody watching this, again, maybe they're a denture wearer or they're headed for dentures. What do you say to them? And they're afraid of pain. They're afraid of all these things.
I invite you to come in and just see what your options are. See how dental implants can help you and benefit you in your life. I mean, 30 years is too long to be wearing a denture. So come in, we'll see, even if you have 1 tooth you need to have replaced, or if it's a full set that you need to have replaced. Come in and see your options and see what we can do for you.
Okay, good. Pleasure to have you on the show.
Thank you so much.
Very good. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.